Hey everybody, Dr. Eric Herman, the Guru Chiropractor and official Team Ringdinger doctor of the Northeast of the US of A. Back again with another new patient, Big Nick. Give me some of that. Big Nick came all the way from Orlando, Florida, just for me. No, I'm just kidding. He does business here. So he's up in Jersey and what else you said? New York and stuff and Florida. So he's up here for business. But he'd been watching the Ringdinger videos for how long? About a couple of years, and he's been wanting to go. I guess today was the right day for him, so he found me up in Jersey.
Yep, close to where I work, and I'm like, let me go try it.
So he's here for business, so he decided to pop in to get his first Ringdinger in full body. We already did the exam and the health history. No red flags, so I pronounce it safe for treatment. But he's definitely got the compression and the spinal issues that the Ringdinger is very effective at correcting. I'm going to go over some of those right now. Main complaint is low back, right? And it's been going on for years. He's got chronic low back pains. You said since you were like teenager, right? It hangs out around 2, 3, 4 on the average, but you have episodes where it gets really severe for about a week, about every 2 or 3 months. We said, where it gets up to like an 8 or a 9 and it puts you out for
a few days.
Like you called it like seized up, like everything locks up on you. Yep. So he's been to traditional chiropractors and I guess you get some relief, but it's not resolving it.
It's okay.
Yeah.
Like it does its thing, I guess.
Yeah.
Not really in depth
the
way I want it.
Got it. So that's why he found the Ringdinger and it looked like it was more in depth, I guess, on the videos.
On the videos, that's what it looks like.
So that's what he's looking for, a deeper release, maybe. Yeah. I think you're going to get one today. Yeah. Nobody ever accused me of being too gentle. And the Ringdinger is a very big and very deep release. Probably, and I've been getting adjusted too since I'm 15 years old. It's the deepest release I ever got. And I've, in my career, I've seeked out who I felt at the time was the best of the best to get myself adjusted. But this is the biggest and the most intense and the most effective that I've ever experienced. So hopefully you'll have a good experience with it too. I'm going to do my best. Secondarily, and you also have, but it's relatively new, you have some radiculopathy and paresthesia, the traveling pain and numbness down your lateral thigh on the left. Stops at the knee. Right, but that's been for about 2, 3 months, right?
December,
yeah. But it's pretty constant over those last couple 2, 3 months, right? So, folks, that is a neurological sign. High probability it's a pinched nerve coming from his lower lumbars. He does have an MRI. The most recent one was about 2 years ago, but you didn't bring the report. So, by memory, he told me for sure he has herniations in his lumbar spine, but he doesn't remember the numbers, and some herniations in your neck, which you're going to talk. Yeah. So I don't need to know the exact location. I could kind of figure that out through palpation and from where the symptoms are showing up. I could trace it back. So it's not 100% necessary that I get the specific results of the MRI, but it's beneficial. So if you're out there listening and you're thinking about coming in and you have MRI reports, definitely, I want you to bring them into your visit for sure. So also some middle back tension, pressure. It feels real heavy according to you. Basically, those are characteristics of compression, right? So, and then neck pain, no pain in the middle back, you said, but just like tight and jamming and pinching, right? But you do have pain in the neck as well and tightness. The neck, you said right now is the worst. It's 6 out of 10. 5, 6 out of 10, but it hangs out around a 3 or 4 or 5 on the average. But no radiculopathy going down the arms.
The arms are fine.
Just neck. He's got a little restriction and he's got a 3-inch forward head posture, which definitely causes compression in the neck. Without seeing the MRI results, I already know just by looking at his posture that those discs are being compressed. So that qualifies you for the Ringdinger because the Ringdinger is the best, in my opinion. I can't say for sure, but I could say for my opinion, in the world, the best decompression treatment. Non-surgical, conservative, because you're looking. Another thing is you told me the doctors have been trying to get you recommending surgery. because it's chronic and it's not going away probably. But you're like, nope, I'm not doing it.
I'm not doing surgery.
You're staying conservative for as long as you can, which in my opinion, I agree with that. Surgery's risky, and the results are okay, but they're not great. And once you cut, there's no turning back. So I'm not anti-surgery, folks. I just want to let you know out there. There's a time and place that surgery is absolutely necessary, but in my opinion, it should be the last resort because of the higher risk and how it permanently alters your body once they get in there and do stuff. So we're going to do everything we can to help him so that hopefully at least bare minimum you could postpone the surgery and maybe not ever have to have it. How about that?
I'm never going to have a surgery.
Oh, well, of course it's elective. It's your opinion, but I'm saying not have the need for it anymore. How about that?
No, that'll be good.
All right, cool. Anything else you want to say before we
No, good.
jump in? Did I miss anything? No. Oh, headaches.
Headaches.
Also headaches for about the last 5 or 6 years, 2 or 3 a month, but they're pretty nasty when they come.
Yep.
Yeah. And I told him, and I'll tell you guys, people that are watching the video, headaches, the number one cause, not the only cause, but by far the number one most prevalent cause of headaches is stress in the neck. It's called cervicogenic headaches. So if that's what's causing your headaches and we de-stress and decompress the neck, very high probability it could also help with the headaches. So you let me down the road as the time goes by after this visit, if you notice that those headaches have been reduced, let Zach know, text him, because I like to know, because I want to celebrate and be happy for you, let us know. All right, so let's roll right in. First thing I always like to do with all my patients is just warm you up, loosen you up a little bit with a massage. We're going to do that here. So go face back down on this table. Get relaxed the best you can. And I'm going to get the famous thumper massager. You let me know if you don't like it, but most people love this damn thing. Stay as relaxed as you can. And if anything I'm doing is making things feel worse or you're not happy, let me know immediately, okay? And as long as you're nice to me, then I'll ease up.
Go deeper too.
Okay. Hey, you can let me know that too. That's fine. Another interesting thing that I want to say as we're doing the massage, when I was doing the exam, the right side of his pelvis and lower back is much tighter and more restricted than the left, but the major symptoms are on the left. And I see that a lot. You would think, right? Logically, it would seem like the tighter side would be where the symptoms are. But honestly, I see higher probability that it's on the other side. My theory is pull on one side with the jamming and tightness causes pinching on the opposite side. Either way, we're going to release everything that needs to get released. And then the healing process is out of my hands. That's between you and whoever you feel heals your body. It ain't me, though. I know that. God, whatever. Some people think it's just an internal process of homeostasis. Some people think it's a higher power. In chiropractic, we call it the innate intelligence of the body, the inborn intelligence that runs the show, that controls and coordinates all the functions, millions and millions, maybe trillions of functions in your body going on at one time. Whatever's making all that happen, that's what causes the healing, not me. I just remove the interference, unjam the jamming, realign the joints to the best that I can, and the rest is up to whatever that power is that heals us. Definitely. Good. Yep. You good? You liking it?
Oh, yeah.
You give me an hour to stop? Yeah. I I used to practice in the rural Pennsylvania, and all the country folk used to say that to me all the time. Doc, when they liked what I was doing to them, Doc, I'll give you an hour to stop. I'm like, sure. I charge by the minute. I'll go as long as you want. I'm cracking jokes. You're supposed to laugh.
I'm enjoying this.
I'm just messing around. Just enjoy it. Don't let me interrupt your enjoyment. Good. Some of the other standard chiropractors, you'd be driving home by now.
Yeah.
Stop it. I don't want to be like that.
True.
It's truth though. You'd be on your way home. Good. Okay. Nice little warm up for the bigger stuff. When you are ready, sir, come on up on your feet. Take your time. Go slow and smooth. Keep your hands up top. Yeah, a little bit right there. I got to feel the top of your hip bones because we got to line you up for the table to get you pinned in there. Slide down. You're about 2 inches too high. Slide down a little bit towards me. Right there. You're good. You're good. All right. Your job, just work on just getting your body as relaxed as you can be. I'm raising up the table just to the height that I feel comfortable, giving a good pull. And then secondarily, we're going to raise up your knees, which flattens out your lower back and makes it easier to release and relaxes it too. Here comes the knees. Just let the table do the job. Let your knees bend as it comes up. Stay nice and relaxed. Perfect. Perfect. Good. Okay, now we got to pin you in here. It's got to be pretty tight above your hip bones to lock your body down, because when I pull, I want your body to stop short. I don't want it to slide at all. And that's what lets a very consistently get a release all the way down to the lowest part of your spine. If you slid, we would lose some of that force going down. If you understand whatever transfer of energy or physics. So that's why we lock your hips in case you were wondering, you out there. No, relax. Can you handle that? Is that too tight? You good? All right. Let me see. Give me your hands back to me. This is not the treatment. I'm just making sure you're pinned evenly and there's no slack. See how there was a little slack there? Yeah. Good. Now you're good. Keep them here. The towel goes around your neck since you're new, and for the people out there watching, but it's really not on your throat. It's not choking. It hugs the back of your skull and underneath your jaw like this. Okay. But my hands are way too small to get a proper enough grip to pull good. So this towel gives me better grip. And I spritz it just so that it's, better grip so I don't slip when we're pulling. Okay, lift up your neck for a sec, drop it. Good. Most important for you, keep your teeth touching together, but don't bite too hard. Just keep it close. So when I pull, I don't want you to bang your teeth or bite your tongue. Okay. The first thing we're going to do is just a little stretch. I'm not going to do a big pull the first time. We're just going to elongate your spine and do a little traction, okay? So I swear I'm not sneaking up on you. So stay as relaxed as you can. I want to do a little stretch. Just feel how that pulls open your spine. Try to keep your body relaxed as we're stretching. Good, nice and loose. Keep those teeth together. Good. All right, I'm letting you down slow. Good. Take a couple deep breaths. On the exhale, let out all the stress you can. Let your body get loose and relaxed. No clenching. Loose as a goose. Now we're going to do a second stretch, and then we're going to do the pulse. So stay relaxed. First we're stretching. Stay loose as a goose. Nice and relaxed. Let everything go. Good.
Oh, mama, Yanni Pustra.
I don't know what that language was, but big? I think you said a dirty word, didn't you? What language is that? Okay. Now, just take some breaths. Let your body process. Was it painful?
No, not at all.
Did you feel it all the way down, like release, pop, pop, pop?
I felt it towards the middle, not all the way down.
You didn't get all the way down?
No.
Okay.
But the middle, freaking fantastic.
Yes. My suggestion, if you're open to it, it's safe, is let's do a second pull. Let's do a double ring dinger.
Okay.
Because I was suspecting that I wasn't quite tight enough here because
Okay.
I don't know if you noticed when I pulled it squeaked a little bit
Uh-huh.
because the pins weren't in there tight
Okay.
enough. That's probably why it didn't go down.
Okay.
But I'm going to put it tighter and we're going to get the lower because I know that's your
All right,
number one complaint. I want to get it decompressed.
yeah, let's do it.
All right, cool. Nice. No extra charge, too. Stop cursing in Greek. I'm just messing around.
YouTube has subtitles.
It's all right. You could curse. I have a rated R YouTube channel. Stay there. Now, can you handle that or is that too much?
Oh, okay.
Give me this. The tighter it is, I know it's uncomfortable, the less I have to pull. So stay relaxed. Good. Again, we're going to do a stretch first. Get loose as you can. You ready?
Mm-hmm.
Nice and relaxed. First, we're stretching. Nice and let your body go. Let it all release.
Oh, motherfucker. Oh.
Breathe and relax. All right, don't wiggle too much. Try to let your body relax. Did it get down there this time?
Yeah, I get it.
Because I can't do a third on this on one visit.
Yeah, I get it.
Good.
Yeah, this is a poster.
What he said, I agree. All right, that's the ring dinger. Was it deep enough for you? You were looking for a deeper adjustment.
Okay, you sure for
Stay.
now?
Yeah, stay here though. Don't get up. Now he's ready for a nap. Now, before we get you up though, I want to check your neck, maybe do a little more release with a twist. How do you feel now compared to before? Say a few descriptive.
Weird.
Okay. Yeah, I get it. People like what?
I don't know how to explain it. It's just weird. Good weird.
Yes. Here's what we think is happening because a lot of people feel the same way. So much has just been, big release, transformational release just happened, and your brain hasn't caught up with what happened yet. So people feel like confused. They're like, I don't know what the hell just happened, but I know it's good, but I don't know how to describe it. I think it's because the brain needs to catch up with what just happened to the body. Do you feel any different down that left leg? Any sensation coming back or no?
No, I don't think so.
Okay. Sometimes,
Maybe it takes some time, I guess.
yeah. What I have observed is the pain and the jamming goes away quickly, but the nerve pain sometimes takes a little time for this to calm down and the swelling to reduce.
Well, my back feels like.
Yeah. Like laying flat is easier for you right now.
Oh, yeah.
That's perfect. That's exactly what I want to hear. Let me feel your neck. Stay loose. Dude, it's almost perfect already. A little bit more. Relax. Yeah, little baby release, but you didn't need more.
Oh.
Good. Yeah. But that neck is like night and day. Okay. I declare that a proper ring dinger decompression release. Wrong way. So we're done here on this table. When you feel ready, go slow and easy. Come on up. Make sure you're not woozy or dizzy. And once you stand up, though, I want you to stop when you're standing, feel your body, and then tell us more about how it feels different. While you're they call it weight bearing while you're standing up.
I feel taller.
You look taller, damn it.
Jealous.
I am jealous. But
No, it feels not.
less restricted.
I don't feel the pain.
And pain's gone where? In the neck?
In the middle.
Awesome. How about-
Back too, a little bit? I mean, a little pinch over here maybe, but
Yeah.
much better than it was before.
Okay, because guess what? We got more to do. We're going to do more over there.
Okay.
Give me a little love. Am I going to have a lot of Greek people making comments of what you said on there?
No, it wasn't bad.
All right. Okay, I'll take your word for it. All right. Before, when I looked in the exam, your posture wasn't abnormal from this perspective, so there's nothing really to say about that because it was neutral to begin with. Ooh, neck feels way looser. Remember I told you I had a little bump here? That's a lot flatter and more mobility in the thoracics. Not 100%, but improved from the first time and a little bit released here as well. Definitely more looser on this right side, which is the tighter side. All right, now we're going to do more adjusting here. We're going to do what's called the drop technique. So I have to line you up on this table proper. Come down about 2 inches. A little more. Right there. I think you popped a little bit just moving around. Sometimes that happens once you get the ball rolling with the release. I'm dropping the belly down to get more space here to give a deeper release. The table's going to pop up like this, and I'm going to push down on you, and the table's going to go boom, okay? Stay relaxed. Stay loose as a goose. Good. Nice. I'm coming on the other side. That was the pelvis mostly. Now we're going to release up the lumbar spine, going P to A, which means posterior to anterior thrust. Good. And breathe. Breathe and relax is your job. And give me heads up if you don't like anything. Woo, we're making progress. Oh, well, I got to tighten it up a little bit. Good. All right. Now we're going to redo those orthopedic tests. Remember we said in the exam that it's an objective way of measuring progress. So remember when we bent them up the first time, you told me it was pulling more here? I'm going to redo the bend. You tell me if it feels like the same pulling as the initially, or it's reduced, or it's gone. This is how I measure progress, aside from how you feel. We do take that into consideration, obviously. How's that feel now?
A little pull, but not like before.
So reduce, Paul?
Yep.
Great. That's exactly what I want to hear. Most people, that's how they respond. They go from pull to reduced. Now, we're going to try, remember when you had the stiff leg and you lifted? Start with the left leg. Lift as high as you can now. Good. And down. Looked like it went up a little higher than before, but how did it feel to you compared to the first time? It wasn't too bad on this side. Same? Okay. This was the side that was restricted. You remember? So let's see how that's doing. Lift the right side as high as you can. Okay. And down. To me, again, looked like it went up a little better. How did it feel to you? Less effort to lift? Was there any jamming when you lifted that? Good. So that's improved too. All right. So the lower back is doing a lot better. Now I'm going to do some releasing up this way. So I'm going to raise up the trap door. Ba, 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 ba. Stay relaxed. Oh, I got to tighten it up for your body weight. All right, stay loose. Good. Nice. Boom. Good. One more for good luck. There you go, right in that transition area. That's going to help with the forward head posture and the tight shoulders. A couple more drops here in the lower neck. Very good. One more for good luck. Bingo. Remember when I felt that right side, you told me it was sore? Is it less sore or same?
Nothing at all.
Gone?
Yeah.
All right, good. Woo! Those are all confirmational responses that tells me we're doing good. You're doing good. All right, much better tone in your spine, meaning it's moving more natural and normal. There's less tightness and jamming and spasm. These are all extremely good effects. That is exactly what I intend to do for people, and that's what's going to cause the healing and eventually, hopefully, the pain reduction and better function in your back. One more for good luck. Good. All right. Now I want you to roll over on your back, face up for me. How's it feel moving around? Because when you roll around with a bad back, I know it's uncomfortable, but when you improve, it's easier. Good. Slide down about 2 inches. Right there. Perfect. Now we're going to release the collarbones on both ends, a little bit in the anterior ribs. Let your arms come out like a T. Look at me, like this. Good. Do-do-do-do-do-do-do. Can you bring them like here? Good. Stay relaxed. Good. Good. Let this arm go straight out first. Yep. Good. Good. And rest. Oh, also, you remember when we were doing the health history, we talked about that you were noticing that you're having breathing impairment. Does it feel easier to take a deep breath right now? Or you can't tell?
I can't tell.
Okay.
Can't tell.
Well, sometimes, like I said, if you release the thoracic spine, it makes because the rib cage gets compressed, it makes it easier to respirate. So I just wanted to check. Okay. Now we're going to do a knee pull. If the knee needs it, it should release the knee, but also probably get more up in this area. Your job, give me a loose floppy leg. I'm raising you up. Good. Loose and floppy. Drop it in my hands. Stay relaxed. Oh my God, that popped. You okay? Slide up when you're back when you're ready. That was the knee. I can never tell if the hip releases because it's too far away. Did you? Yeah, that knee. They heard that in Florida, I think. Now we're going to do a little pull at the ankle and then pop the toes. You go with that? Drop it in my hands. Yeah, that knee release. Good. Good. Relax. Good. Relax. Good. All right, same thing on the other leg. Drop it in my hands, floppy and loose. Let it go here. Good. Slide back up a little bit. Whoop. We do the knee. We'll do the ankle now. Let it go. Boom. Good. All right. Making progress. I'm bringing you down. Ground floor. All right, now we're done on this table. So make your way back up on your feet. Notice how it feels getting up. See if it's easier.
Much easier.
Very good. That's function is improving too. When you're ready, have a seat back on the stool. Face that way though. Yep. Good. All right, we're going to do a couple more things and then we're going to be done with today's session. We're going to release the elbows, the wrists, the fingers, both sides. Then I'm going to recheck your forward head posture, remeasure it, see how much it improved. Then we'll talk about what to do next. I'll give you some guidelines for post-treatment care and for follow-up recommendations.
Right.
Drop it in my hands. Drop it to the floor. Heavy and floppy. Drop it and flop it. Good. Relax your wrist. Good. Woo. Let it go. Let it go. Boom. Okay, same thing, other side. Drop it to the floor. Loose. Good. Floppy, floppy. Boom. Relax your elbow. Pull. Got it. Bink, bank, bonk. Done.
I'm gonna kidnap you.
I'm gonna kidnap you. Listen, I'd live in Florida. Now let's see. Already I could eyeball it and I could see for sure it's improved, but I want to do an estimate measurement. Do. Yeah. Yeah, it came back like an inch. Not bad for one visit, but 3 inches is pretty severe. So now it's only 2 inches, which is pretty significant. A few more visits within a year, within a couple months maybe, and that'll even reverse more. I can't say for sure, but usually that's what happens when we do some multiple visits.
Well, yeah, first visit, it's not going to be foolproof.
It's not perfect.
Yeah.
I tell my patients, let's look at the camera when we talk, because we gotta relate to my fans out there too. I tell my patients, I'm a good doctor, I admit it, and the ring dinger and the techniques I do are amazingly effective, but I'm not Jesus. I don't do miracles, in other words. So don't have unrealistic expectations. Most patients do well, meaning they're improved on the way out from their first visit. Not all, but most. But don't expect perfection from one visit. It's not realistic. Especially you've had your back's been chronic for
one visit is
20 years.
I feel the difference, but I definitely need more for sure.
Yeah. All right, cool. Well, let me ask you a few questions because I want to see subjectively, your opinion. You told me the lower back was about 3 or 4 when we did the intake. What number would you give it now?
2.
Okay, so improvement.
Maybe 3, but no, it's much better.
Improved.
Well, yeah, much better.
What about any difference in that down the leg, or is
Over
it?
here?
Oh, that side. Sorry,
Yeah.
I'm checking. Be honest.
No, yeah.
Yeah.
Maybe a little bit, not too
Yeah.
much. Maybe a little bit.
Okay. Sometimes, like I said before, I observe the neurological symptoms usually take a little time to heal, so it's not instantaneous. Once in a while, but not the norm. All right. How about your neck? You told me the neck was 6 out of 10 when you came in here.
Yeah, it's still like a 4, maybe a 5.
Okay. So
But
some
over
reduction.
Here, over here. Still,
Yeah, you got a little
yeah,
stuff
over
going on.
here, yep.
How about mobility? Do you feel looser? Better
I
movement?
I don't feel the pressure in the middle back.
That's what I mean.
Yeah, I feel much better over there.
Good. Okay. I think my measurements told me it was a successful visit.
No, it was.
Okay.
I mean, I can feel it. Maybe I'm not explaining myself the right way, but it's a difference.
Good.
It's a difference.
Good.
A good difference.
Perfect. As long as you're happy, because my policy is you can't leave till you're happy. We keep working.
Oh yeah.
But I told you that after you gave me the report, because if I told you that before, some people might lie and make me keep working.
I'll remember that for the next visit.
And no extra charge for the Greek curses.
No,
It's okay.
It's not Chris. Don't worry about it.
Do you have any questions? Any questions for me?
No, not at all.
Okay. I want you to take it easy, if at all possible, for the next couple days to allow for maximum healing. Because you really don't heal today. You get released today. You heal after the release. And you want to, for maximum recovery, you don't want to you don't want to mess with the healing process. So sometimes too much activity could interfere with you healing properly. So take it easy if you can. If you get sore or the pain is still active, icing is very effective to help reduce the inflammation and the pain and the swelling. So I would put applied ice wherever you have sore spots. Like 20 minutes on per hour is a good regimen, as much as you need over the next 2 to 4 days. Wait a couple days before you make a final assessment, because like I said, as you heal, symptoms could even calm down even more, right? After a couple days, 3 days, make an assessment of how you feel. If you still feel like, yes, this made a significant difference for me, but it's not all the way fixed, which is probably going to be the scenario for you, and you want to come back. I know you're traveling, so you're not going to be around all the time, but just come back as soon as you can, and we'll do another one. And we just keep doing that as long as you feel like you need more and you're making progress. We'll keep doing that until you're happy.
All right, cool.
Good job, my friend. Let's say goodbye to the folks out there. Big Nick, after his first ring dinger, I think he's happy and doing better. Dr. Eric Herman, the guru, team ring dinger doctor of the Northeast. I serve, most of my patients come from New Jersey, Pennsylvania, New York, some a little further north, some a little further south. Occasionally I get somebody traveling in by plane. I don't care. There's a lot of other ring dingers out there. I'd rather you have a less stressful visit than come from far away, unless I'm the closest guy to you. If I am and you want to come to New Jersey and you feel like this is going to help you and you want to try what I offer, I would be honored to help and serve you, and I will do my very best. That's my promise to you. The best way to reach me is my website, guruchiropractor.com. It's probably up on the screen somewhere. Go there. There's a book now button. Is that what you did?
Yep.
Click that book now button. It asks you to put your name, your cell phone number, and your email address. It goes directly to my assistant. He gets a notification. He grabs your info. He texts you back, and you guys work out questions. And if it works out and you're happy and satisfied with what we offer and our fees and all that stuff, our policies, come on through. I'll do my very best to help you like I did with this guy. Peace and love to everybody out there. God bless you. Out.